Nikki, honey, welcome back. We are talking about, I think, both of our favorite subjects, definitely hormones, but particularly menopause and potentially even perimenopause, because goodness knows it all kind of just blends in together. And most importantly, I love that you and I are going to spend time together busting myths around menopause. And oh my goodness, there are so many myths. There's so much misinformation. I feel like it's the word that's been whispered for decades, yet half of the population goes through it. It's an inevitability. I'm curious. I know why I love this topic. I know why I love serving women in this demographic. What was the impetus? What was the passion around wanting to write a new book, particularly around menopause and making it spicy around the myths of menopause?
Yeah, well, first of all, thanks so much for inviting me back, having me on again. But exactly, we can share our passions. Why the myths of menopause? Well, as you mentioned at the beginning, fundamentally, my passion being a medical doctor and specializing in hormones, I think hormones are amazing. They are.
Yes, yeah, that was our big
Indeed.
conversation
Yeah,
last time.
that was, but out of all the hormone systems, which I also mentioned last time, it's for women and this female hormone odyssey that they go through. Every single woman, as you said, every single woman will experience this odyssey, this change in her hormones. And it will be, of course, it sort of follows this certain path, but her own experience of that will be very different from one woman to the other. And one of the challenging, like with any journey, there will be hiccups, delays, things don't quite go according to plan, you know what I mean? The car gets a puncture, there will be things. That's life. Things happen. And this is focusing in on the particular part of that female hormone odyssey, the menopause. Effectively, that's when the ovaries retire. Hopefully for, most women, they've been working pretty hard, to be fair. They've been working really hard from the time your periods start, maybe 12 or so. And, they've been working hard and now they come to retirement, average age about 51 or something. They retire. But there is kind of reluctant retirers, if I can put it that way. So they don't just suddenly one day shut up shop and say, fine, that's it, finished. It's not like a light switch on and off. And that's what you're describing, the perimenopause, the lead up to it, when they can't quite make their mind up, to be honest. They're sort of going part-time and it's a bit up and down. So this is why this particular part of the female hormone odyssey is so challenging, because every woman will experience it differently. And although the general gist is that the ovaries are retiring, everyone's ovaries are different and they will do it in a different pattern, different way, or feel it in a different way. And it is quite a big change from what you've been experiencing. And then once the ovaries definitely retire, now in some ways it's sort of calmer because now you're in this static state, but it's very different to where you were before. And the thing I find really interesting, there's some parallels between this perimenopause, the ovaries just sort of going a little bit off kilter, if I can put it like that.
I call it the descension.
Yeah,
I call it the reckoning, honestly.
The sort of the unwinding, like I said,
chaotically unwind.
Yeah, chaotically unwinding. It's not a schedule.
It's not ease and grace over there.
No, it's not sort of smooth choreography, but it's very similar actually to what we go through when periods start during those teenage years. If you sort of think back, and that's can be quite a bumpy time. We talk about teenagers, hormones are changing, but guess what? Same, it's this mirror image. And the thing is, for a woman, if she's got children, not every woman I know has children, but if she has children, then probably she's going through this roller coaster. And guess what? If she's got a teenage daughter, they're both going through roller coasters. In the one case, the ovaries are coming to life. In the other case, they're sort of winding down. So going back to your original question, why did I want to write a book about the myths of menopause? I wanted to unravel it, but I wanted to sort of go in quite hard, if I can put it that way, rather than a sort of a dry textbook. This is what happens, or a handbook. It's like, let's pull out what I know as a doctor, what women are asking me, and what I see out there, where there are the areas of confusion and myth. And by the way, some of these myths, well, quite a lot of them, frankly, are, myths and not correct. But there might be a few, actually, that might have some element of truth or just maybe in a different way. So that's why I wanted to write that book, to really give women the information so they can make those informed decisions, be prepared, and all that sort of thing. And I'm the editor for the book in this case, so I got with some help from some friends.
Yay, I love it.
Yay, help them from friends who have particular areas of interest in psychology, in nutrition, whatever it is. So some help with my friends to, really dig in deep and look at these myths. And one other little thing to say is that on the front of the cover of the book, because I wanted to think about this female hormone odyssey and focusing on this bit of the journey, but I did feel a bit uncomfortable because Odysseus was a man. He was the man.
I was going to say it wasn't a woman. It's a man's world in a lot of ways.
But guess what? But guess who led him through that journey with her wisdom? Athena, a female goddess. There you go. She was the wise one, and she's on the front cover with her shield and her wise owl. She is the one that will guide you. Just as she did for Odysseus, she will guide you through your female hormone odyssey. There we go.
I love it. And I'm assuming this is personal for you as well. I mean, I feel like, and not everyone goes through perimenopause, menopause being the inevitable, but some of us for various reasons may even skip, whether it's ovarian insufficiency or it's premature menopause, those kind of things can happen. But I was curious if this was deeply personal for you as well. I know I'm in perimenopause right now. I'm 45. I'm really in the eye of the storm. And I have not a teenager, but a three-nager. So I have a 3-year-old, which is very different.
Oh my goodness.
I had him when I was in perimenopause.
Wow.
And so it's such a different, fun adventure, but luckily he's not in puberty, thank goodness. Like I can imagine that'd be a very different experience. But also what I find, definitely there's a lot of parallels and mirrors between puberty and peri, with the big distinction of that we were living a different life when we were in puberty. Now it's a higher stakes game. We're moms, or we're partners, we're professionals, and it's not an ascension, it's a descension. Like we're going,
I want to make it more positive than that, but you're right. Facts are facts. It has got a slight negative connotation because, as you say, there will be some women who have ovarian insufficiencies or early menopause, or indeed a surgical menopause if they have to have their ovaries removed. So I don't want to. I am acknowledging that there are those women, but nevertheless, on average, the
most
majority
of us,
will be what is going to happen in middle age. Yeah. And middle age already, if you say that word, it sounds a bit like
nobody wants to hear that.
No, and it's getting older.
Yes.
And a little reminder. So I think you're right. It is, whereas puberty, you feel like you're going
coming
somewhere.
In. Yeah, you're going in.
But now you're exiting in the wings, you see. So, which is true, but that's okay. Because by the way, when dancers retire, they often continue dancing, but in a different role, character roles, you see. So that's the thing. You're still value in your life. Of course there is. And also, you want to make the most of that bit of the life, because probably we live quite long nowadays, that you'll be spending a third of your life in menopause once the ovaries have retired. So I agree, there is a negative spin on it because it means, you're getting older. And whether you've got children or not, that's a full stop. That's the end of that. And so that can be a bit sad. Whether you've got children or not, that's like, you haven't got that option anymore. So I do accept that it is a challenging time for those reasons, but nevertheless, I'm trying to give it more of a positive spin and say it's a just different section of your life, just like a ballet. So I love my dancing, as you know. It's just like, okay, you're not totally, okay, you might have gone off the wings as the prima dancer, but ballerina, but now you're coming back on as the character dancer, as the mother for Juliet or whatever in the ballet, you see. So you've still got an important role to play, whatever that is, whether in your work, as you say, if you've got a family, with your friends. So I think we need to emphasize the positive sides of this,
Absolutely.
And actually, there are positive sides. Maybe if you have got children, well, they're growing up for you, but there will, but still, it's a different phase in your life. There will be different opportunities. And so I think looking at it on that, because there's no point looking back and lamenting, I wish I could be 21 again, because facts not going to happen. So I think busting those myths that you're over the hill and that's it and you're finished and that's the end of your life and just give up now, that's already a big myth. But you did ask me personally about this, and obviously being a medical doctor and obviously with a super interest in hormones, I felt I was pretty well informed and I did my homework and I kind of knew what was coming. But it did occur to me, especially during that perimenopause time, like in the eye of the storm, as you say, it's like, oh my goodness, wow, if I didn't understand what was happening, it would be really scary, literally. And that's one of the contributors. Am I losing my mind? What's going on? Why am I this different person, this mad woman who is like really angry or really sad, and this woman that's so anxious she can't do her work, which she's been doing for 30 years. This is crazy. What's going on here? Why can't I sleep? Why? It's like, why am I absolutely sweating right in the middle of an important meeting? It's just like, you know, all those things. If I didn't know what was happening, literally, it would be so scary. So there was a personal mission, message, I suppose you would say, because if I thought, well, if you didn't have any knowledge or not much knowledge, then, and this was happening, you would be really frantic and wonder what the heck was going on. So that's another rationale, well, for me being a doctor in general terms.
Yeah.
I want to make a difference to people's lives so that they
Yeah.
can understand and can be empowered, take control. And actually, here are some myths, here are some things. It's not the end of your life. And it doesn't, HRT, of course, can be helpful, but it's not the only solution. There are other things that will really help. So that was another rationale, I suppose, as you said, from a personal point of view. I wanted to make sure that every woman would have the facts and the information that she needs.
I love that. And I do agree with you. You know, when I stepped into perimenopause, I think because I was still recovering from postpartum, it was all a little blurry. And it took me about 6 months, you know, after years of taking care of patients, taking care of women in perimenopause, it still is a little bit of an acclimation. Because initially you're like, is it just that I just didn't get to sleep a lot last night? Or I think sometimes subtly when you start to feel those subtle symptoms, it feels like an elevated version of the daily pain points that a lot of women have been told we just kind of deal with. And then they kind of,
as women, we just get on with it. Let's be honest. We just get on with it. And it's easy to attribute, your body's trying to tell you something, but then, like you say, we will sort of say, oh, well, it's just, I didn't sleep very well because there was a noisy car alarm, or you sort of make up almost reasons or excuses, I suppose you would say, when actually, if you just look at it,
do the math
absolutely objectively and say, hold on, I can't explain away all these things just by whatever, and there is something going on. But also going back to you, if you don't mind, and saying that one of the contributors to the book makes this point that she also was in, and I don't think she minds me saying because everyone will be reading it, that like you, she was actually had a child and then was sort of relatively recently postpartum, and she was feeling like, is this really how I should be feeling? And everyone was saying, oh, it's just because you're tired and you've got a new child, but actually it was perimenopause. So that's another thing. Whenever it hits you, at whatever stage you are in your life, I think naturally, especially as women, we just kind of soldier on and just think, oh, well, whatever, rather than actually just hold on a minute. Something is really changing here. And what do I need to do? And I need to give myself that time to reflect and see what are the actionable things I can do so I feel in control of this, which comes to the lifestyle piece, which I think is so important. Sometimes it gets sort of skimmed over a little bit.
Yeah, I think in a lot of ways, and this is why I think some of the myths have been developed, at least when I was doing the deep research around that, is that if women didn't know that perimenopause was happening and they didn't really understand how menopause occurred, and there was just, oh, it's just these few symptoms, then they were like, oh, well, these other things that are happening, they must not be related. It must not be that I'm going through this. And so there was definitely a disconnect and a miscommunication, but what women were experiencing and what they were being told they were supposed to be experiencing. And that level of confusion had led a lot of women into like, oh, I don't know. I just end up in menopause. All the other stuff before that, I mean, it was hard, but no one could identify what was happening with me. And so there was a disconnect. And then the other thing, because there was so much misinformation around that for a long time, that I think we were just told to, like you said, just push on, kind of suck it up, buttercup. And we probably stayed in default mode. And so I think when we accidentally stay in default mode and we don't listen to the signals of our body and make those changes that you have elicited to that we're going to talk about, then it ends up that over time, things do shift, and not necessarily in a great manner, that lend to issues in our early to mid 60s that could have been on our radar in our mid to late 40s. And so I think
you make such an important point, such an important point. And by the way, the reason why, it's like, well, this seems really weird. The ovaries retiring, why would you have potentially, I call it Pandora's box, all these things? Because hormones affect every single cell and every single system in the body. So on the surface, it seems totally unrelated. Why would being anxious have anything to do with your hair being really dry? It's like, that's you know what I mean, or some or digest, you know,
Or
really
your
like
eyes being dry, or your muscles
exactly.
hurting,
So
or your
exactly.
belly fat, or
Well,
gosh, the
yeah,
number
with
of
the
things.
list, exactly, Pandora's box. So it on the surface, it just seems, it does seem really weird. How can all these things be connected? But the answer is because of the hormones are
Yeah.
changing, and the hormones, like we say, going back to that. And also the other point you make is that some women sort of almost feel apologetic. Well, I've only got hot flushes, but then it's like, hold on a minute, you've only got hot flushes, and oh, but what about that bad sleep you said you're having? And what about being tearful all the time? And then all the other things that people have pushed aside. Or you don't have to have the whole list equally. You don't have to have every single one. There
Oh, the
might be
40 plus symptoms? No.
yeah, you don't have to tick every single one to qualify for
Yes.
having a tough time. It's like, you know,
Yeah.
if it's a change for you and it's disrupting your quality of life and what you normally do, that's what it is. Not, oh, because somebody else said they were even worse than you or better than you. You have to do it for you. The person who knows your body best is you. So I think that's the other thing. We should have confidence. We know our bodies. We've been working. We are what we are for the last, whatever, 40 years. So you shouldn't question yourself. If you feel that something isn't quite right, I think we have an instinct, because as women, it's like, well, hold on, that isn't right for me. This isn't what it is usually. So what's going on?
I love that. I really do. I agree with you. We don't have to have all the symptoms. It can be, it's deeply unique, like you said, for each and every one of us. And the point I want to go and reflect back on is that these are whole body hormones.
Yeah.
I think the myth that we've been told, one of the big myths that I feel around menopause, I'm curious if you think so, is that ovaries retiring are just ovaries retiring. Like, oh, they're just over there doing their thing by themselves in a silo.
Yeah.
And those hormones, they're just connected to fertility and reproduction, and then they're over here in a silo. But all these symptoms are all over the place. And I feel like the common denominator is that these whole body hormones are, as my dear friend calls them, unconscious uncoupling, is that they're erratically uncoupling from those receptor sites, particularly in the brain, vasomotor symptoms, brain fog, mood swings. That's all brain related, sleep issues. And I'm curious, this is kind of in my own research, I feel like losing these life-giving hormones. I mean, not that we aren't designed to go that next third or even a little bit longer than that of our lives, but I'll be remiss if I wouldn't say that, man, I'd like to keep them a little bit longer.
Yeah, well, I think, and that's actually one of the sort of myths, the very first chapter that I wrote, and said, problem is that we think ovaries, hormones, reproduction. That's the only purpose of the ovaries and the hormones, and that's all but as you said, we're talking actually, these hormones go way beyond that, and that's totally to misunderstand the nature and the beauty and importance of hormones. And you also mentioned a really important thing there about mental health. So physical health, because health, what is health? It's physical, mental, and social. But by the way, you can't be social if you're feeling really dreadful.
Yeah, you
but
go
so
inward in that.
It all goes together. And so I think that you make such a valid point, which is, as I said, one of the main myths we go for. It's like, well, why is menopause? Why should we acknowledge and not sort of say, oh, it's just a little thing that happens, the ovaries retire? No, let's acknowledge that actually this is a big significant event for a woman, significant in that terms in her life, but also it's going to affect how she feels and potentially her long-term health. So but if you understand that as a woman, it's like, okay, fine, tell me what I need to do. If you say that, it's like, okay, fine, I get it, these are hormones, these are important, what do I need to do to
mitigate,
continue feeling good
yeah,
and being healthy? What are the changes I need to make? And I think most women would like to know that information. But if hasn't been acknowledged that this is something that you can do something about, and that we do recognize it is a challenging time, of course, you're not going to know what to do, are you?
Exactly. And I think that's been, if I had to name a great menopause myth, and I'm so grateful that it is your number one first myth as well, is that we just pretend that this is just one day in time, that, oh, ovaries are done, we are done, we shut down the HPO axis, and let's just move on our merry way. It's going to be fine. And I'm like, but is it? If we don't shore up and prioritize that we're losing muscle, that our metabolism is shifting, that we're becoming more insulin resistant, that glucose metabolism in the brain is shifting, that these are the things that can play out.
Facts are facts. And if you don't want to sort of wait around until, you do develop an illness, a disease. And the other thing, for example, the main cause of death in menopausal women, it's cardiovascular disease. It's not breast cancer. So I'm not minimizing that we should talk about breast
it's a
cancer.
yes and.
Go and get our mammograms, of course, but actually, as you said, the cardiovascular health, the body composition, the metabolism, the silent killer, osteoporosis, all these
disease
things.
And frailty.
So, I'm not in the game to try and scare women, but I'm just saying, look, these are the facts.
Facts are facts.
You can plan ahead.
Yes.
You don't have to wait until you get
we definitely don't wait until.
You don't want to wait until you get it. No. Yeah, you need to, if you know that is something you need to do something about now, then so it's not just about how long you can live, it's how long can you live in a healthy way. So that's really
there's a major disparity for us, which is we live longer, 4 to 6 years longer than men, our male counterparts. So our lifespan is there, but our health span is not matching up. So there's a big disparity. That is if I had a purpose, it is closing that gap. It's closing that disparity between health span and lifespan. And I really do believe it starts in perimenopause as these hormones are kind of coming offline erratically. And and there's so much we can do once we get to that defining moment of menopause. But I think of menopause, and I'm curious what you think of this. I think of it as a late signal that your body has been talking and it's been saying, hey, excuse me, I'm losing some of these things over here. And once we get to menopause, a lot, either we didn't make those pivots or changes. We've got that hormone depletion at that point. We can see a lot of things already kind of starting to lock and load in terms of our health and overall well-being. And so I was curious, I'd love to kind of head into the foray of hormone replacement therapy. I just want to let you know where I stand on them. One, I'm a yes for them, but I think of them as optimizers. They're not going to fix the horrible poor sleep or they're not going to fix the ultra processed food diet. They're not going to fix you sitting in a chair at work for 6 hours a day. They're not going to do those things. And so it's always a yes and when it comes to, I think, HRT, at least in my view.
But going back on that first point, that actually, again, looking on it in a positive way, your body in perimenopause, your hormones are trying to speak to you. They haven't got a voice in that sense, but they have got a way of saying, excuse me, we're changing, right? Just heads up.
Excuse me.
Heads up, excuse me.
Signal.
Exactly. There's a really rough patch in the road just there and we might be coming to an emergency stop. Anyway, so it's just like, hey, can you, just to let you know and give you advance warning, because if the hormones are changing, then it's an excellent opportunity to change what you're doing.
Yes. Oh, absolutely.
Because your hormones respond to what you do. So if your hormones are changing, then obviously it makes sense to change what you're doing. And so again, looking on it in a positive way, this is an opportunity to refresh, revise, review your lifestyle choices, the nutrition, and your exercise. Those are the key things you have under your control. As Hippocrates said, do you remember I quoted him last time? He said, if we could give every individual just the right amount of nutrition, just the right amount of exercise, not too little, not too much, we would have found the surest way to health. He didn't realize that 2,000 years ago, by the way, why that was true. He was right all along 2,000 years ago. And sometimes we kind of lose track of that. But it's because those actions that we do will harness the hormones. So if the hormones are changing, then this is a great time to have a look. Like you say, sometimes we do slip into bad habits with the nutrition and for the exercise, we're busy, maybe we don't do, whatever. So, your hormones are speaking to you. This is a good time, like you say, to refresh, review, revise. Actually, let's have a look at that diet. Am I maybe skipping breakfast and then I'm having processed food because I'm so ravenously hungry later on? Is that really the best way of doing it? Maybe I should spend a bit more time, thought, and have planning of the nutrition and the exercise. Actually, I'm making excuses. I don't have enough time, but actually, maybe I should go and do that strength session, or go, in my case, go to my ballet class or whatever it is. So I think it's a great opportunity. And if you can get those fundamentals right, not only does it feel good, it feels that you're in control, right? I am making a positive thing. And then, as you say, if you then go on and decide, right, I do want to have HRT, then actually the HRT will have the better effect. If you go straight for the HRT, it obviously will help. But actually, if you haven't got those foundations really as optimally as you could in terms of the nutrition and the exercise, it will do something, but not as much as benefit as you could get. So I think this stepwise approach is exactly, I totally agree with you. Doing everything you can, and then sure, HRT, I agree with you. Disclaimer, I'm on HRT.
I was going to ask.
I mean, I was, I felt I was doing a reasonable amount of exercise and my nutrition was okay, but still I made some little minor things like the protein. But actually,
increasing protein.
now I'm saying to my husband, right, I want a bigger portion of chicken this evening, thank you. So it's just making those little tweaks, and the exercise, doing a lot of exercise, but actually the strength exercise doesn't have to be necessarily weights. I hate weights, I'll be honest.
Oh,
Right?
I never imagined that you're such
Yeah.
a big, I always think of you as someone who is always moving,
Well,
especially
exactly.
you love dance. Before I actually was in between interviews today and I knocked out a 15-minute strength
Wow.
training.
Brilliant.
Yeah.
Look at you. So it's finding what the reason I mentioned that is lots of women, we say strength training, and I'm one of these women. I immediately visualize, oh, lifting heavy weights. And I really that is a turn off for me. So I'm saying, if you want to do that and you can do it, brilliant, go for it. But if like me, you're like, I'm not even going to go there, then actually look for alternatives that will work for you. Pilates,
Yeah, what's working for
to
you?
do something. Exactly. So
Oh,
anyway.
but Nikki, honey, what is working for you? And I was curious, when did you know? Because I agree. I mean, knowing what you know, and in our interviews, it's very clear that you're very intentional about your health and also about your patients. And in your books, I feel like you've done such a great job in that level of due diligence. And so I was curious for you, for me, being in this world as well and knowing that I was checking all the boxes. I always joke that my metabolic biomarkers were like a chef's kiss. And when I wear a continuous glucose monitor, we're talking optimal blood glucose levels. And yet I was really struggling with my brain. Listeners know I had a brain injury last summer, and I always tell people, don't have a brain injury, but definitely don't have it in perimenopause, when your brain's already up in the air.
And a young child. Yes,
yeah,
exactly.
and a young child at the same
thing.
time. And so as I was navigating the end of that journey, and it was the mood and that deep sense of life feeling insurmountable, and I was just like, oh wow. And yet I'm moving my body, I'm meditating, I'm in the sauna, like I'm eating metabolically healthy meals, lots and lots of fiber, and yet, oh my goodness, my brain, it was like someone was just scrambling it and having migraines. I remember thinking like, gosh, for as much as I'm doing right, like my progesterone was already at postmenopausal levels. I'm taking progesterone, and I've been playing a little bit with supplementing with estradiol. Once I was like, okay, let me see if I can mediate a lot of this with lifestyle things that I've banged on for, like I've really created pillars for years, and have come to my aid. Like I can always double down on the pillars. And yet when those things weren't shifting some of my most disruptive perimenopausal brain symptoms, I was like, okay, well, it's time to bring in the bigger dogs. It's time to look into,
Exactly. So like we said, we don't want women to be just pushing on and thinking they've just got to get on with it and get over it, or whatever the words are. So absolutely do all your, as you say, due diligence with your lifestyle, with your nutrition, your exercise. But then we shouldn't be made to feel ashamed or weak or feeble. That, okay, that's what HRT is for. And actually you mentioned and make a very good point about progesterone. And in the book, I've got the wonderful Lara Bryden to write something about progesterone. And Geraldine Pryor as well, Professor Geraldine Pryor.
Dr.
Basically,
Pryor.
she's the menopause.
She's like the queen of progesterone for perimenopause. Yes.
Because the interesting thing in perimenopause, because we all know that ovaries retire, all the
estrogen's
progesterone and estradiol are low. We all know that.
All of
it's
gone.
This weird thing in perimenopause, especially in early menopause. In perimenopause, in early perimenopause, actually, strangely enough, the estrogen actually, if anything, is maybe higher.
More estrogen dominant, more unopposed.
Exactly. And then you don't get so much progesterone. Certainly, Geraldine Pryor and others are actually saying progesterone definitely would be really useful. And she's done studies to show this is really helpful in that early perimenopause.
Absolutely.
But then obviously as we get closer to menopause, and certainly at the time of menopause when the ovaries officially retired, yes, facts are facts, then now estrogen definitely is also coming down. So HRT is the combination. For women, if you've still got a uterus, then I'm sure your listeners will know, then HRT is effectively estrogen and progesterone. Both of them together is important.
And without a uterus, you still deserve progesterone.
That's another, and I agree.
Okay.
Of course, that's what Geraldine Pryor says. And that's also what I found with some of my patients I'm working with. Very interesting. Women who have had hysterectomies, so they don't have a uterus. So officially, on paper, you don't need to take progesterone, you just take estrogen.
To protect the uterus. Yes, that was the reason we did it.
So that was it.
Medically.
Exactly. So progesterone was this unsung hero. It's just like you just have it for endometrial protection. And of course, course, that's
I
true.
just major eye roll. Yes, it's a yes and.
Yes,
it's not...
exactly. No, but in the women, I've come across a couple of women now who have just been on estrogen, and then okay, they officially don't need progesterone for endometrial protection, but we've added in micronized progesterone, right? So body identical, all right, and it's like the brain. It's like, oh wow, now it's like phew. So
it is like a light bulb on.
Yeah.
It's like low thyroid function, and you bring in some thyroid, and you're just like, oh. It's heartbreaking to me, you know, the kind of the way in which we've kind of sorried into HRT, particularly estradiol or equine estrogen, so Premarin, though that first yucky hormone, discovering that, oh, it's causing endometrial cancer unopposed. And we're like, oh, but we can fix this problem by bringing in a fake progesterone. That was all we thought of it, you know, for so long. And just breaks my heart that it's still very much a part of the medical dialogue or the standard of care that, okay, oh, you don't, I just had a patient a couple days ago come to me, and she was like, oh, my doctor won't prescribe it to me anymore because I had hysterectomy. They're like, you don't need it. And she's like, but my sleep is awful and my moods and everything. And I was like, well, they're wrong. Like, go get a second opinion and see if I mean, that's the beautiful thing, particularly about bringing in progesterone. As you interviewed Laura and Dr. Pryor, a lot of side benefits versus the side effects of bringing in some natural oral micronized progesterone. And I would say it's worth giving it a try, you know, uterus or not, to see if it eases some of those symptoms. And if it does, well, then it's, you know, it's a full body yes, especially for the brain. I know for me, progesterone has been a lifesaver in my own journey. And I play with doses around 300 milligrams sometimes in my cycle, depending on how severe my symptoms are.
That's what Professor Pryor says, and she found in her study. She's in Canada, so it was a Canadian study. It's that, and it was 300 in perimenopause.
Oh, that can feel so good some days.
Yeah, exactly, because the thing is, it helps you sleep. You know, it's a natural sleeping antidote, and lots of the problems, like as I quoted before, sleep is the chief nourisher and life's great feast. Well, not me quoted, but that's Shakespeare. But anyway, and that is so true, because you know, if you can get a decent night's sleep, then a lot of things fall into place. So if progesterone is going to help you do that, and you're right, you know, why wouldn't we do that? If it's micronized progesterone, that's body identical, so it's not mucking up, it's not the synthetic stuff.
Like it's not causing.
So it's not what one hasn't got any concerns about side effects. And in terms of, so I agree with you, and that's also my experience with women who have had a hysterectomy, and so they've been told, oh, you don't need a progestogen component of your HRT. Just take estradiol or whatever and you'll be fine. Actually, it really is beneficial. And so in my book, In the Myths of Menopause, exactly, this is something we bust with the help from my friends. And, you know, saying, actually, this is something in the future, hopefully we will see more of, that progesterone is given early in perimenopause, and that even though officially or on paper you don't need it if you've had a hysterectomy, what's the harm? It's always the risk benefits, you see?
And it's you don't need it for protection.
It's body identical one, it's okay. If it's a synthetic one, then I agree. Maybe you have to say, well, could that cause a side effect, whatever, but it's kind of a win-win. So we'll see.
That's my, you know, and that's why I loved having that nuanced conversation with you in the first interview, is talking about whole body hormones. And when I think about progesterone, she's not siloed just to the uterus. She's doing a lot. I mean, we're talking about the brain, ligament protection, metabolic protection. I mean, we got to give that hormone a lot more credit than protecting the uterus from endometrial cancer for women with uteruses. I mean, it feels like such a small-minded way of thinking about such a profound hormone that is a whole body hormone. And given my own N of 1 experience with it, I can't, I mean, pry it from my cold dead hands. Let's just say that.
Well, exactly. But by the way, you're not just N equals 1, you're Geraldine Pryor's study as well, and what lots of us are now saying and recognizing. But yeah, that's also the other joke, when people say the other myth. How long can we take HRT for? Okay, so, well, first of all, it's like, well, when do you start it? And that's from our discussion.
Yes, that's up for discussion.
You can see that actually it would be a good idea, rather than saying when do we start HRT, it's probably when do we start taking micronized progesterone. That would be the first one to take, because that's the one that goes
early 40s, ladies.
Yes, exactly. and then sure, then you're going to add in the estrogen after menopause, because that is also dropping. So then you have both like that. But then, like, how long do you keep taking it for? And, it used to be banded around a myth, oh, you can only take 5 years and that's it. But that makes no sense. So you feel good, you get okay for 5 years. Now we're going to take it away from you, like a naughty child. It's like, now we take it away from you, and good luck. You're going to go through all that stuff again. So certainly in the UK, the British Menopause Society have made a very clear statement saying there is no arbitrary limit for how long you should stay on HRT. Obviously, you discuss that with your doctor and common sense prevails.
Absolutely.
My mother taking it for a long time, but then, she did become sort of elderly and a little bit more frail in her 70s. It's actually, now she's got to take some other medications for Parkinson's. And do you know what I mean? It's like, actually, it's not practical for her to be putting gel on herself every day. And you know what it is? It's just not. So it naturally stopped. But I do joke that people are going to prize it out of my hand. It's like, give it back. And you're not taking that away from me. But it's just common sense. If you're getting on with it and you're fine, there are no side effects, and everything's going well, then why would you stop it? There's no reason.
Yeah, if the benefits outweigh
Exactly.
And I mean, and when I think about hormones and what their job was for our lifetime, and especially in midlife, it's protection, immune system protection, brain protection, cardiovascular protection, general urinary protection, bone remodeling protection, insulin resistance. Yes. And so if we can continue that on,
why wouldn't you?
With the lifestyle, like we're actually doing weight bearing, or we're moving our body in a way that's helping that bone remodeling, we're building that muscle mass, we're helping to support our microbiome. We're doing all these things in tandem, and we're still getting all of these preventative benefits, because the second you come off, those things start to come back. Those things start to rise up. We lose that bone remodeling. All of a sudden, that cardiovascular protection begins to decline. Brain neuroinflammation may start up. And so I think as long as the benefit is serving and you are reevaluating, I mean, I think even in perimenopause, as we talked about, what your hormone regimen, your hormone replacement regimen looks like at 42, it's going to be very different than 48, in terms of dosage, and if you're bringing an estradiol or not at that point. Maybe, I don't know, for some of us, maybe a little bit of testosterone, depending on what's going on. And just the journey through perimenopause with HRT will look different during that transitory time. And then in your 50s, it could look a lot different, HRT, than in your 60s. And so I feel like if you've got a good team working with you, you get to continue to pivot as we move through those decades.
And that's actually what happened to me personally. I started on a certain dose of HRT. I opted for the gel. I much prefer that. Don't like a patch, because I go swimming and I've got a lot, I didn't take offense, but a lifeguard once asked me, oh, what's that scar you have on your hips? I've seen lots of old ladies with that. It's like, oi, what are you trying to say? Because I've got hip replacements. So it's, look, I don't want questions about patches anyway. So I definitely wanted the gel, by the way. And also I felt it was easier to personalize the dose, because if you're putting on something every day, then you can tweak it.
You can kind of tweak it, which is nice.
Exactly. And I prefer the sachets, because again, I don't want to go through the airport carting a whole pump of estrogen. It's just like, anyway. So I started off on 1 milligram of estradiol gel, Sandrina gel, because it's more concentrated than the pump, and our favorite, the micronized progesterone, Utrogestan, it's called here in the UK. And I started off taking the Utrogestan in blocks of 12 days of 200 milligrams. So kind of very, very crudely replicated the menstrual cycle, because I just kind of felt that was more physiological.
So a slightly, in a little bit of a rhythmic way.
Yes, so I started taking it like that, and then after 5 years, they recommend if you were taking it in that sequential way, rhythmic way, then it's better to switch to the continuous. So for me, that meant 1 milligram of gel every day, and now 100 milligrams of the Utrogestan every evening, okay? And I wouldn't get any withdrawal bleeding. So I switched to that, and that was all fine. But then I was just like thinking, I'm not as bad as my perimenopausal symptoms, but it's just like, I'm just like, my sleep isn't so good, and I'm a bit hotter, and I just wasn't quite feeling so good. So I checked with my GP, and I said, look, I think maybe my ovaries are even more firmly retired than they were, if I can put it that way. And it's like, okay, fine, let's increase the estradiol a bit. So now I'm on 2 milligrams every day. N equals 1, but I'm giving it as an example.
Yeah, no, give an example of how you've navigated.
I can do that because this is my information, so I'm releasing it. I'm not divulging someone else's information. So I'm happy to do that. But making that point is a very individual, for you, the journey, because your journey, the hormones, and sometimes even the ovaries even might have a little flurry.
Yeah.
I got some bleeding. I was like, oh, really scared. Wow, what's going on? And, I had the scan and blah, blah. Yes, no, the endometrial lining, it's all right. Blah. And I said, well, this is really weird, to the gynecologist. And she said, yeah, sometimes it happens. She said she's seen it.
Oh yeah, it absolutely does.
Sometimes the ovaries do funny little flurry or something. So I think for women to have that knowledge that you can and you should insist on personalizing your dose. And women I work with, and I'm sure the same for you, that I explain this, and we're going to start very low and see how you go, and we're going to just see where you need to go, and it might change over the years, because in the UK we've had a little bit of a problem where HRT went through all this swings and roundabouts. So it was like there's a big social media scare, as we know, oh, it causes breast cancer, and then it's almost swung the other way here in the UK. Actually,
it completely swung the other way here. It was the number one prescribed drug until the Women's Health Initiative.
Yeah, exactly. And so we have had a problem in the UK where actually, people have gone straight in and given a woman a really high dose. And so that's not a good idea for any medicine. You want the lowest effective dose. So I think to encourage people, and hopefully you agree and you do the same, let's just start off at a low dose, and we're going to tinker with it, but don't be disappointed. If you're doing all your lifestyle things, and let's see how you go for 3 months, and then we come and review and see, do we need to tweak things a bit and whatever. So that's the other thing I would say to women. Don't be upset. I have some lovely women who send me a little email literally after a couple of days and say, oh, I don't feel any difference. Like, no, it's not days. We're talking 3 months, I would say. Let's make an assessment. Do we need to sort of just personalize the dose? What's going on? So that's another thing. Don't be disheartened. It's not the elixir of youth. Newsflash.
Yeah. Yes. And I agree. Don't be disheartened. It takes a minute to even I love all the nuance. I just want to reflect on all the nuance of making it work for your lifestyle.
Yeah. That's true.
So when I started to kind of play with, my migraines have gotten really bad, and we thought maybe estradiol would be supportive. And so initially, cream was recommended, but with a 3-year-old, I'm carrying that 3-year-old all the time. Yeah. So it was absolutely a no-go, because I can't get that on him. So I'm in a different stage than a lot of women who are looking at estradiol. Like, I'm carrying a child. And so the patch was the thing that I was trying. And so mainly because that was really the only option for me as a young mom to a young. So it's interesting, the nuances. Also, yes, exactly. My PMS, mood and brain changes really hit a pinnacle halfway through that luteal phase. So I'll do 100 milligrams in the first half, and then I'll bump it to 2 to 3 in the second, based on my symptoms. And I'll take even 100 milligrams in the day and then the 200 at night to equal out my symptoms throughout the day, plus that extra bolus like in the evening for the sleep and all those other benefits. And so again, it's really tailoring it to what your experience is, what's working best for you. And obviously, like you said, it's not only symptom management and making sure that we have a little bit, that protection that we want to maintain. And so I am a proponent of let's start, get you going, nothing super crazy, see how you do in terms of symptomology, test on the backside, make sure we're within the realm of where we want you to be and that you're feeling really great. And then we can move from there, along with adopting the lifestyle pivot. As you mentioned, perimenopause and menopause is a moment of realization that maybe what you got away with in your 20s and your 30s, you don't have that wiggle room anymore. And also, if you've been putting yourself first for decades, or maybe a decade, as a mom or a partner or a caretaker to parents, that it's a shore up moment of saying, okay, I need to prioritize me. Like, I have to prioritize me if I want the second half of my life to be as robust as the first part of my life. And so I think that's what perimenopause, it's an opportunity to face ourselves.
Absolutely. Make the time for you, like you say. But I love that example. Suddenly it's like, of course, for me, I was describing that the gel was much better than the patch, but exactly. Yes, that is true, and a good point, that if you have got a young child, you don't want to be, you'll be as holding
lathering
them and moving
estrogen
them
on them.
Lathering estrogen on them.
No.
Like, that's probably not a good thing. So again, that's part of the personalization, not just of the dose, but of the route, because although it's probably better to take estrogen through the skin, for example, there will be some people who, for whatever reason, don't absorb it, or they can't, or find it very difficult to take the gel, whatever, or the patch even. And so we're not, again, women shouldn't be made to feel bad. Oh, it has to be through the skin. That's the best way. That's the only way. Sometimes taking it orally, if that's what's going to work for the person. So I think the personalization goes to not only the dose, but also the administration route. And there are mix and match options, which is quite good. It's
I
quite
love
fun.
that there's so much variety.
Mix and match.
And I know it can feel overwhelming to the everyday woman of just like, why is there so much variety for this? And why it can feel so complicated. And just as much as we are steadfast about our overall health and well-being, we get to be steadfast about our HRT regimen as well. And I'm loving that we're busting these myths, because these are big myths around, you know, some life-giving hormones that can really support women in a big way. And we're busting the big myth that they're the end all be all, that they're I mean, I'll be honest with you, Nikki, if there was a magic bullet, they get kind of close to it. And we talked about why they're not 100% magic bullet as well.
But certainly very helpful if you're doing, you know, your lifestyle, using that opportunity to refresh, review, revise, then it can be very helpful. But equally, the myth in the book is like this. I describe it in the book as going back to the female hormone Odyssey. In his journeys, Odysseus had to sail between two really perilous things, Scylla and Charybdis. One was a perilous whirlpool, the other was a six-headed monster. And that's sometimes how it can feel with HRT. Women are really stuck there, and there are these camps over here that are shouting very loudly, saying menopause is a natural physiological thing, it's really weak and feeble, you don't need to take HRT, that's you know, whatever. And then there's the other camp over there saying, oh no, you're idiotic if you don't take it, and take really high doses. So it can be really confusing.
It is.
Like, it's made out there's a right and a wrong. There's these two things. But guess what? If you go in the middle and you do what's right for you, what you feel comfortable with, and you do your research and you figure out if you're going to take HRT, make sure it's at the low dose, the appropriate dose, and you've got these mix and match options. Does seem confusing, but again, it's worth, you know, persevering and finding out what really works for you. So I think that's the story about HRT. It is, let's be honest, it is pretty good stuff, but no one should feel pressured either way. You have to make the decision for you.
I love that. Nikki, I'm so grateful that you've written this book, that you've brought in some incredible experts that I admire and know very well as well. I know that there's a lot more myths to bust, but I'm glad that we got into the ones that are the most concerning for so many of my audience as they're trying to navigate this journey into menopause and beyond. This is going to be going live when the book goes out. And so can you share where we can grab the book? Is it going to be on the website? Where else would you love us to go and find you?
So the book you can pre-order it right now.
Oh, great.
On Sequoia Books, and with a discount code. And guess what the discount code is? Athena.
I love it. Okay,
the goddess of wisdom. You're right. So you can pre-order it now, and it can be shipped overseas. And then, yes, it will also be on Amazon, US Amazon, although that's, for some reason, don't ask me about Amazon. It takes a bit of time to get it there. So those are places you can get your hand mitts on the book. And then for me personally, I have a website, Nicky Keay Fitness, that's me. And you can see what I'm up to there. I do offer advisory appointments, and I'm giving talks various places, and there's more information about the book there. So yeah, please come and check it all out. And I really hope people find the book useful and interesting.
All right. Thank you so much, Nikki, honey.
My pleasure. Thank you so much for the lovely discussion.